Over the years, different myths and misconceptions about cancer have been brought forth. These myths have increased stigma and reduced chances of cancer patients seeking treatment early. This has resulted in lost opportunities to prevent cancer and successfully cure the disease. On the 4th of February this year, World Cancer Day was commemorated under the theme Busting Cancer Myths and Misconceptions. According to the National Cancer Registry, Zimbabwe records on average 7,000 new cases annually, and an estimated 1,855 new cases of cervical cancer are diagnosed every year, while nearly 1,300 deaths are recorded. Cancer Association of Zimbabwe Information and Research Evaluation Officer Momo Kurirofa says for the fight against cancer to be won, it should revolve around demystifying these myths.
The first step that actually needs to be done is dissemination of correct information about cancer, because we find out that these myths and misconceptions are militating against the success of the nation in tackling cancer.
Cancer patients who shared their stories say the major setback on cancer treatment and cure has been lack of knowledge. They say the battle against cancer will only be won by creating awareness.
Tikaenda kunorapiwa cancer ichangotanga zvinotibatsira pane kuregera uchimboora zamuroora wozotanga kuti wechinorapwa hazvizobatsiri. Ndopai patinozoti cancer inouraya. Cancer pachayo haiurayi kana ikakurumidza kuonekwa.
Hurumende inyoro mapamphlets anonyorwa neshona nendevele because vamwe havagone kuverenga chirungu, chichiendeswa kumamisha, muzvikoro, muzvipatara uye nepanoungana madzimai ese kuti vadzidziswe kuti gomarara rezamu rakamira sei, nekuti vamwe vanotya kungoona kabundu kari kadiki diki anokasiya, haakwanisi kutaura, haakwanisi kuenda kuchipatara, anotozouya bundu riya pamwe raputika chaachironda.
A local oncologist, Dr. Anna Nyakabau, says cancer is curable, but many people are reluctant to get screened early, and this reduces chances of getting cured.
When we screen these women, we can even catch those with cancer at an earlier stage. And when the disease is still at an earlier stage, the patient can be cured. The chance of a cure is much higher.
The most common cancers in Zimbabwe are Kaposi sarcoma in men and cervical cancer in women. Cervical cancer is most prevalent in black women than non-black women, whereas Kaposi sarcoma is very common in black men than non-black men. National Cancer Registry figures show that at least 32.2% of women diagnosed with cancer in 2010 in Zimbabwe had cervical cancer. A gynecologist and oncologist, Professor Mike Chirenje, allayed fears that traditional and cultural practices cause cervical cancer, saying there is no evidence that cervical cancer is caused by the use of herbs and unhealthy practices in the female genital tract.
The evidence is clear that cervical cancer is caused by an infection. It's a viral infection called human papillomavirus. And the human papillomavirus is a very common genital tract infection which occurs in women. And the majority of women actually do not manifest any long-term effects for that virus. They're able to kick it out of their body. But a few women, when it persists on the cervix, 10 to 20 years, persistent presence of HPV on that cervix. And this has just a few types actually. There are about 15 types. All in all, there could be 40 types which affect the female genital tract. But out of those, only 15 are known to cause cervical cancer.
Cancer patients have highlighted the need to rope in churches, saying this could also be a panacea to the cancer fight in Zimbabwe. This has been welcomed by religious leaders who say the church should complement the government in the fight against cancer through the provision of moral and spiritual support to cancer patients.
Like HIV and AIDS, during the early years where in churches people could not speak about, you actually will be surprised that for the greater part of the many churches, there is no mention of the issue of cancer. So that is the background in which I'm saying that, against which I'm saying that the Evangelical Fellowship of Zimbabwe in particular has decided to engage as the Cancer Association of Zimbabwe to ensure that we break this silence in the local churches.
Muslims, we play mainly a supportive role so that those who are affected this disease have moral support and also spiritual support to enable them to keep going, because we all know that as a disease, once one is affected by it, their spiritual life also gets affected.
The government has also not been sitting on its laurels and has stepped up its efforts through the adoption of the National Cancer Strategy that will provide guidelines on how this disease can be fought on a national level. In the 2014 national budget, the government allocated $500,000 towards the awareness and advocacy and has upgraded radiography machines at Parinyatwa and Pilo hospitals through financial assistance from the International Atomic Energy Agency.